the CEO of the Greater New Bedford Community Health Center, who is joining us this morning. And tell us, first of all, how are things going in general, considering COVID-19 and everything going on? In general, how are things going?
Well, I have to give a shout-out to all my team mates at the Greater New Bedford Health Center. Their spirit and commitment is strong and thriving every day there to make sure we give really good care to our patients and to be part of the public health strategy in the Greater New Bedford area.
Yeah. I'm a huge fan of the Community Health Center. It's been around for quite a few years, and its importance is unmatched in our community. Before we talk about the COVID-19 testing site, tell us why it's so important that people consider the health center, community health center.
Well, our mission is twofold: to ensure that we provide high-quality medical care to each individual and family, as well as our role in looking at public health out in the community. So our role doesn't really end inside the health center. We want to get out and see what the community needs to be a healthier population as a whole. And a healthier population means a healthier workforce, a more successful business community out there. And we know that education and income is a really big determinant of people's health.
Yes, absolutely. Has anything changed since this COVID-19 outbreak, hours or any kinds of changes there at the health center?
Yes, we have in fact reduced our hours. We were open in urgent care from 7 a.m. to 7 p.m. Monday through Friday and open 8 to 4:30 on Saturdays. Because we reduced our workforce, many people had to go home to do childcare when the schools closed down, and we've had a pretty precipitous drop in serving patients for other health reasons. People are kind of staying home if they're not really sick, and so to be able to continue to serve, we went to a kind of a one-shift operation from 8 to 5:30 Monday through Friday, same hours on Saturday, 8 to 4:30. And we've changed how we practice, where you might go. We had individual providers and practices under the roof of the health center. We've really now moved about 70% of our work to telehealth. That's to try to keep patients out of the health centers and to keep my staff home so everybody avoids exposure as much as possible, helping to stop the spread of the virus. And then on-site, we really have gone into pretty much 2 urgent cares, one for COVID-related symptoms in patients and the other for non-COVID-related diabetes, hypertension, other things that may really require an in-person visit. And everybody has to be screened at the door, temperatures, masks on, all of that, trying to minimize, again, transmission throughout the health center.
Yeah, no, absolutely. Well, that's understandable. Tell us about the testing center there at the Greater New Bedford Community Health Center. Folks who aren't feeling well, for instance, can they come down there? Give us what can we expect when we come down to be tested there?
So we moved from testing inside to outside, Phil, and that was we were selected by the governor to be one of 12 health centers to expand testing access. And so in order to test more people, we needed to get outside of the 4 walls, inside a closed exam room. The air doesn't circulate sufficiently to remove the virus in a timely manner. We have to leave rooms closed for 2 hours if there's been someone with COVID in an exam room, and when we're outside, that air is just flowing and keeping the virus moving and not stagnating, and so we can test more people more efficiently. We are asking people to make appointments because we do pre-registration. We do a telehealth visit before you come, and then basically you come in and out, verify that you had an appointment and your information, and it's really about a 5-minute procedure once you come for the test. So anyone symptomatic, we recommend you calling and getting an appointment, and we'll get you in there. We're moving people in pretty quickly, so there isn't a long wait to schedule an appointment. And slowly we're moving. The state this week recommended that we begin to test people without symptoms but are a close contact of a positive case. So we, again, can begin to isolate, quarantine, and contain the virus from continuing its spread.
Oh, that's interesting. We have quite a few senior citizens who tune into our radio station. And any message for our older adults in the community, Cheryl?
Absolutely. They're one of the higher risk populations that we worry about. A lot of the numbers of cases and deaths associated with this have been in an older population. And so we recommend that while it's really difficult to remain so isolated, that it's really critical for them to avoid coming in contact with any potential asymptomatic or symptomatic person. But the asymptomatic are most concerning because we're less worried about people that are not symptomatic, and that's a bit of a false sense of security. As we age, we all start to add some ailments to our lives, and so people with other conditions are at a much higher risk. So age and comorbidity with diabetes, hypertension, heart disease, asthma, those are all risk factors for people that the virus seems to attack more readily.
Absolutely. And I've told our listeners time and time again, Cheryl, that I'm not only excited about the Community Health Center, Greater New Bedford Community Health Center, but I'm also as they say, a patient here. I believe in it so much that I put my full stock and faith in the Greater New Bedford Community Health Center. And folks, I want you to understand that whether you can or cannot pay, regardless of that ability, the health center is here for you. And it's unlike, the doctor's office. Everybody, every single human being who comes there will be cared for. It's a beautiful concept. I just want you to know that. I have you on the air, and I just wanted to give you a public pat on the back for a great job, Cheryl.
Well, thank you for that endorsement. Some of the doctors there are some of the best doctors. I also happen to be a former practicing nurse, and we have some awesome doctors there, and and providers, great nurse practitioners, and the model is compassionate care, that they're not there to kind of crank people in and out of there and make money. We're there really irregardless of the ability to pay.
Right, exactly. And you have an impressive background in public health. So tell folks a little bit about your background, Cheryl.
Well, I had the great honor to be the Commissioner of Public Health under Governor Deval Patrick, the first and only nurse to serve in that position, and I highly recommend other governors think about nurses. I think our very holistic approach on caring for the individual and their family and all of their social needs make us, I think, uniquely qualified for a role like that. But it certainly taught me a lot about managing pandemics. I was around for the Ebola virus and the H1N1, and as a nurse, I was around for the AIDS epidemic. So we forget these things over time because we learn to manage and live with them and control our lives, and that will happen with this too. It's just a new disease and a new virus that we're trying to understand, and I think within a couple of years, when I'm visiting with you again, Phil, well, that will be in our past.
That's right. As in life. Folks, if you are feeling ill, perhaps you're not feeling quite right, I'm going to give you the phone number to call for an appointment, because the COVID-19 testing is by appointment. Please keep that in mind. Don't just show up. It's very important that we follow this process at 508-992 6553. That's 508-992-6553. And again, our Commonwealth has designated community health centers, including what I consider to be the model for many of the health centers across the state, Cheryl. Our Greater New Bedford Community Health Center. What a fabulous job you've done in creating a wonderful model, a role model for the others to follow. I have maybe a minute left here, so I'm going to give you this minute for a final word or anything that I didn't ask that you'd like to share with our community.
I just also like to tell them that not only is the health center working on COVID virus, but under the mayor's leadership, we have a daily meeting with South Coast and Hawthorne and the health department and the fire and police department. We're really working collaboratively to understand where there might be need and to get out and address that. So I have to give a shout out to the mayor's leadership in this. So it's a citywide effort.
That's awesome. It really is. Thank you. What a great note to end on. They truly do care for our community, a patient at a time. And Cheryl, anytime you need to get the word out to our community, we're here for you. We're going to back you up 100%.